Okay, we're going to review this ultrasound. We're starting out with a sagittal view of the cervix. And the first thing we can notice is that there is a lot of tissue overlying what I would assume is the cervix right here. We do see this little V-shaped area, which is going to suggest to me that this is probably going to be a lower uterine segment contraction. All this echogenic area here is kind of suspicious. You're looking at that thinking, hey, could this be a previa? But the placenta is actually back here. So we're going to be worried about a previa, but I'm thinking, looking at this, it's probably a lower uterine segment contraction. And she's fortunately measuring the cervix when in about the area that I would suggest we would measure it. And looking at the right head and neck, so left head and neck, and nothing going on. We're going transverse inferior to superior to assess fluid lie and everything else. So we can already see this is going to be a transverse fetus with the head over to the maternal left. The placenta is posterior. The fluid is looking okay. There's fluid interspersed around the small parts, and the head is filling the cavity, as is the chest. And now sagittal views of the cervix, and we're going to see the baby in cross section now because it's a transverse lie. And we're already seeing a nice cavum septum pellucidum. Beautiful posterior fossa, the vermis is intact, the cisterna magna is not enlarged, the cavum septum pellucidum looks normal, the thalamus looks normal. You could actually be worried a little bit that the nuchal thickness is enlarged here. We can actually measure it. And even though it looks sort of big, it's still less than 5 millimeters. Here's a better measurement of it because we can actually see the posterior skull, so we actually know where to measure it. And this echogenic line is going to be the actual skin. You're going to volume average a little bit into other skin, so we're still less than 5 millimeters. And this is actually um, the perfect plane to measure CSP here, thalamus, and the cerebellum. Here's an even better measurement. We could measure it again if we're really wanting to get aggressive. Still around 4.9. So it's less than 5. We're happy. The lateral ventricle, the choroid's filling it, so we don't even need to make a measurement, but when we do, it's normal. I just made this a little bigger so that we could actually see these measurements. Nice biparietal diameter. We're not seeing the cavum itself, but we're seeing the columns of the fornix just below the cavum, which is fine. The thalamus and the tentorium of the tentorium cerebelli, which is above the cerebellum. If you're seeing the cerebellum in this picture, you're actually measuring to obliquely, and you're going from outer bone to outer bone to inner bone, which is fine. This we like. It's pretty tight to the calvarium, a little bit out here, but not a big deal. Another good measurement. See the nose and lips, which is fine. Nose and lips, which looks good. Nose and lips again with arms. So we're seeing arms, we're seeing hands bilaterally, which is good. Another view of the face. The orbits look pretty normal. Orbits look normal. Profile, I always like to see the nasal bone in the profile. Looking at the chin, the lips, the nose, it looks normal. We're actually getting a little view of the RVOT here and the ductus arch, which looks normal. And the stomach appears to be on the correct side. Here's a great 3 vessel view. You can see we're pretty high up. We're a little bit, the ribs are seeing 3 ribs on that side, but we're also seeing 3 ribs on this side. So we're pretty axial, although we're angled up a little bit. And we see the, if you want to call it the line dot dot or the dot dot dash view, but this is the ductus arch, the aorta, and the SVC. Now we'd like these two to be about the same size, or this one to be a little bigger. You could argue this is slightly bigger than this one, but I'd probably pass it. Here they look about the same size. Notice as you get a little higher, the aorta starts crossing over here. It can get confusing a little bit if you're not used to looking at that view. It's going to cross over and attach to the descending aorta right there. And now we're going down a little lower. We see the 4-chamber view. You draw your imaginary line here, and here, and it's at about a 45-degree angle, and this is going right through. Let's make this the middle of the chest. Here's the two ribs. We're a little bit obliqued. We're going to say maybe right about there, and that line goes perfectly through what we like to see. Heart rate looks normal. Here's a abdominal circumference view. We see the stomach. We're seeing a little bit of the umbilical vein coming into the left portal vein, but we're not seeing the nice little curve there, which means we might be a little bit oblique, but we'll take that. And we like it to be tight to the skin. That's the best we could do. It's not going to make a huge difference. We're going to pass that, and we'll pass this too. And we'll pass that too. She did 3 because she was thinking, hey, maybe I'm not getting the perfect measurements here. 2 legs. We see on this leg that the foot is in a coronal view with the ankle in a coronal view, so we're happy there. Same with this one. Same with this one. No signs of club foot. The cord insertion, we're not seeing any definite abnormality. I think this is part of the cord. I don't think there's anything coming out there. And we'll pass that. The femur length, I like the way she did it, not including this femoral point, so-called femoral point here. I don't know if I can make this a little bigger or come over a little bit so we can see the whole picture. Up here, that's the femoral head. This is the trochanteric region with cartilage, all cartilaginous. So we like this measurement. Same thing here, we like the measurement. Picture of the bladder. We should see the cord splitting around it, touching both walls of the bladder. That's normal. So it's a 3-vessel cord. Gonna head down through the spine. Everything's looking okay. There's no big masses extending out from the back of the spine. The posterior elements are angling the correct way. Here you could start to think, am I getting tricked? What's this? Is there a big opening here? I don't think so. The skin is covering it. There's no cyst. I wouldn't be worried about it. Sacrum, iliac wings. Sacrum, we see bone down there. We're happy. Along here, this is where you can get tricked a little bit. You wonder, am I looking at vertebral abnormalities here? Why is this spacing kind of weird? I think that's just what you normally see, especially in this curving area. Really hard to pick up anomalies in this unless you're really looking for it. And on a general screen, you're not going to see that typically. Here, I like to see the sacral upturn with skin covering it. So here we're seeing a little bit of pelviectasis. We're going to measure it, only measuring 3.3. Less than 4 is okay at this age. All right, great. She's gone back to the cervix. Now the lower uterine segment contraction is gone. We see the cervix. She's going to call that the tip of the placenta, and we're going to believe her. And we're going to move on from there. Here is another nice view of the spine. Here it looks totally normal with a nice sacrum, nice skin covering the sacrum. We're happy. Foot, exclamation point, great. Here's a much better profile. The face is flexed down now. Gorgeous nose, lips, chin, everything lines up nicely. There's a nasal bone here, and again, we're happy. Another view of the fourth chamber of the heart. Great. Moving on. All the measurements look pretty concordant. We look down here at our little femur length, AC 19.1, 20% is lower, so it's saying, all right, in relation to the abdominal circumference, the femur is a little short. Well, the abdominal circumference is a little big. We know we kind of over-measured it. The femur is a little bit shorter, but most of the time when you see that, it's actually due to just a short parent. Okay, I extended that out a little bit so we could see everything. Bottom line is 20 weeks 0 days is the ultrasound EDD, and the clinical dates are 20 weeks 1 day. Size is consistent with dates. We agreed the placenta was posterior, there was no previa, the cervix was normal, and there was a transverse lie with the head on the maternal left. We agreed with all that. Right, in the history there was something mentioning a fibroid, and she did not see a fibroid, and she mentioned it, which is great. And we're going to take a look at our cine clips here. And I always like to do a cine clip of the head. We see a nice ventricle cord is pretty much filling it. The cerebellum looks normal. The cavum the cavum septum pellucidum is normal. We're going to look at this nice view of the heart. We see two valve leaflets here. We see two valve leaflets over here. Not that well, but we're going to pass it. The intraventricular septum looks normal enough. Always looks like there's an ASD. That's just the patent foramen ovale. We do see coming into the left atrium are the pulmonary veins, so it's always nice to see. Nothing coming in over in the right atrium. And finally, I always like to get a nice cine showing the apex of the heart is on the same side as the stomach. Here's that little pelviectasis, but it was within normal limits. And we're done.